Hello everyone, I hope you all are fine. In this video, I'm going to review about a very important book for neurologists, for physiotherapists, for neurophysiotherapists, and for any clinician who want to practice uh, neurology and basic for a physiotherapist also. And if you are a clinician and manual therapist, rehabilitation therapist, then if you are dealing with any nerve pain, then you can study this. Even if you are dealing with the musculoskeletal conditions, then you can read this book. So this book is about clinical neurodynamics. The name of this book is Clinical Neurodynamics, and this book is beautifully written by Michael Shacklock. So Michael Shacklock explained that how the nerves work in our body clinically, and the usual method what we used to think, like the nerve is static, it cannot move, but in this book he explains how nerve can also move like a muscle. Like a muscle is moving, so our nerve can also move like a muscle. And we all have, the nerve have different properties like extensibility and different properties which the muscle have. And there is a very detailed structure about the nerves. If I'll tell you one example, suppose earlier, before reading this book, I used to think that the nerve is like a thick band, like this. You have a thick band, and the nerve can go slide forward and backward, and that's it. That is the function of nerve, and it supplies to a muscle. That is, it transfers your information from your body to the mind and your brain to the body. Okay, but after reading this book, I got to know that muscles does not actually just move like this. It can also stretch a little bit, and it moves like in helical structure, okay, like a spring. So the muscle moves like this, not like this. So it's beautifully explained in this book why it is happening, how it is happening. Muscle also, nerve also have the nerve supplies. Nerve also have the blood supply. So it is in detail. So if you want to learn about three things that this book is telling you, those three things are: the nerve system moves like a structure, not like a solid static thing. And second thing is assessment is everything. So in this book, assessment, focus on assessment has been uh, given, and it is explained that why assessment is important and how you can assess the nerves, like not only ULTT or LADT. It's also about the different nerves, how we miss the different nerves. We just know for the median nerve, ulnar nerve, and your radial nerve. But in this book, other nerves are also mentioned. The third thing is integrated treatment approach. So effective management comes from combining the manual therapy, movement, and patient education to desensitize the nervous system. So how to desensitize the nervous system? It's already been written in this book. And if you ask me about my story of this book, so when I was in masters, I guess I have started reading this book. Yeah, maybe in masters. So it is a very amazing book because my thesis is on neuro people, and I was a neuro student, so I have done my masters in neurophysiotherapy, and my patients were diabetic neuropathy. Sorry, diabetic neuropathy, and in this I have treated the tibial nerve. So how we have found the tibial nerve, how to assess the tibial nerve, how I have given glide, and there is a technique called nerve flossing technique which I have used in my patients, and I have seen that there's a very good results and significantly improve in ankle flexibility and your balance and all these things in the diabetic neuropathy patients. And it was also published. If you want, I can give you a link also. And if you go to Google Scholar, you'll write my name in a correct format, you'll get the all my publications there. So there I have published the diabetic neuropathic patient publications also. So in my opinion, this book is a must for every physio working with pain, neural mobility, or chronic dysfunction, and it is a technically incredibly practical book. So, and flossing has also been given in this book, like it's not given in the other books because in this book, Clinical Neurodynamics, every nerve is explained in detail, and how you treat that nerve is also explained in details. And you have given some practical information that how to move the nerve and like which movement you have to do to mobilize the nerve. And this is basically an amazing thing that you can actually target the muscle like the way you target, sorry, you can actually target the nerve like the way you target the muscle. Because if you're a physiotherapist, you can deal with muscles like biceps, triceps, so eh, as same as you can deal with the nerves. And it is an advanced book for the people who have already done physiotherapy, or people who are doing or have done the neurology, MPT neurology. If you read this book, you'll be somewhat in next level. I have read this book, I guess, 2 3 times, and it's amazing. So the important thing is you don't have to remember everything of every book. But there are some books which actually change the way you think, the way you assess, and it adds to your clinical knowledge. And this is one of the book which adds your clinical knowledge, so that if there is any pain, if there is any patient with pain like neurological pain, then you can think extra, what we can do and why this pain is occurring and how the pain has occurred. So you can all think about this. I hope you are finding this videos helpful and you'll uh, get this book and read this book. So thank you so much for watching my videos, and don't forget to subscribe my channel. Thank you so much, and we'll see you in next video. Bye bye.